SI joint fusion is performed in people who have SI joint dysfunction. I think it's an incredible and underappreciated cause of low back and buttock pain, often done in 3 patient populations. Number 1 is patients who are women who've had multiple children. Number 2 is elderly who have degenerative changes. And number 3, in patients who've had some sort of lumbosacral fusion. Oftentimes what they can get is adjacent level disease, which is they have the fusion and the area above or the below that can get degenerative changes. And if they have a lumbosacral fusion, the area below is the SI joint. For those patients that are identified or thought to have SI joint pathology, they undergo an SI joint injection first. The SI joint injection comprises of a numbing agent and a steroid medication. The injection itself is given within the joint itself. So if this is the sacrum bone right here and this is the iliac bone, a small needle is inserted in the SI joint and that numbing medication is placed along with the steroid. The numbing medication works right away, so patients notice a significant improvement in their pain right after the procedure. Unfortunately, the numbing medication doesn't always last too long, so often within a few hours or by the next day, all their pain comes back. The steroid is the one that gives them long-lasting relief. Oftentimes, the steroid takes a couple days to kick in, but may last them for several months. Now, patients who get SI joint injections, a subset of them will get tons of relief with just the numbing agent, meaning for a few hours or less than a day, but not really get the prolonged relief with those steroids. Those patients would be excellent candidate for SI joint fusion. SI joint fusion is done in a minimally invasive way. There's 3 ways to really do it, but the least invasive of them is the posterior approach. A small incision about 1 to 2 centimeters is made in the lower back. Through that small incision, a pin is dropped between the SI joint utilizing fluoroscopy or X-ray machine. Through that small pin, 2 small tissue dilators are placed, after which a small working cannula is placed between the SI joint. Once the working cannula is placed, which is less than about this big, that fits in the 2 centimeter incision, either a bone dowel or a metal allograft is placed in the joint itself, and then everything is removed and 1 or 2 stitches are utilized to close the skin. That's pretty much the whole procedure. It takes me about 15-20 minutes to do, and it takes about 1 stitch or 2 stitches to close the entire skin portion up as well.